Hi everybody, welcome back to another conversation with the Commissioner. I am here at the Fishers Health Department, but with one of the members of the IDOH Trauma and Injury team. So if you want to introduce yourself to everybody.
Yeah, hello everybody. I'm Maria Cariaso. I'm the Injury Prevention Program Coordinator at the Indiana Department of Health.
Yeah, well, thanks for joining me here. So we're here to talk about fall prevention. So I will say, I often mention, that I get to still work in the emergency department, and falls is something that I take care of on every single shift. And we know that for people over the age of 65, it is the leading cause of trauma and injury is falls. Mm-hmm. But it doesn't have to happen. This is preventable, and we know that it has, pretty bad morbidity and mortality for older people to have that fall. So tell me about what we're doing at IDOH and the work that you're doing in trauma and injury prevention to help promote this, and what are some of the programs that are available?
Yeah, thanks for having me, Dr. Weaver.
Yeah, of course.
So, helping older adults stay healthy as they age can be a complex challenge. I would say it's a nuanced problem, meaning that it requires a deep understanding of interrelated factors that play into it to be able to address it effectively. So, balancing the management of chronic conditions to ensuring overall safety is vital. So fall prevention specifically is an area that trauma and injury prevention specializes in and offers support and services in. So Stepping On is one of our programs, which I think is a really great program for it because it offers a holistic and really integrative approach when it comes to prevention programming. So diving a little bit deeper into Stepping On, it is an evidence-based program that has been rigorously researched internationally. It actually started in Australia. They saw an elevated number of falls in a certain region, and now it's made its way to the United States, and we have since adopted it. So it has been a huge success, I would say, in terms of our health departments as well. They've got waiting lists, which has been wonderful.
That's
great. Wonderful turnout. And so diving a little bit deeper into the logistics of Stepping On, participants meet for 2 hours a week for 7 weeks, and it's highly participative. It's a small group community, and what I really love about the program is that we invite medical guest experts to be able to provide their specialized knowledge and expertise into the class. So we've got physical therapists, optometrists, occupational therapists, and vision and pharmacists. I think is what I was missing. So really, we touch on home modifications, vision review, medication review, and many other relevant topics. So it truly is a multifactorial approach when it comes to fall prevention.
Yeah, and we know 31% reduction in falls, right, for the Stepping On program. And, all these things like medications can make you at higher risk of falls. We always talk about pulling up throw rugs and other interventions that people can do at home. And I know my grandma does Tai Chi, which is another program that also helps with fall prevention. So excellent. And you support helping make sure that health departments have the right resources, which is why we're here at a health department, and really excited to hear about the work that's happening here in Fisher. So thanks for being here with me today.
Good.
Appreciate it. All right. So now we're going to hear from the Fisher's Health Department and how you guys are implementing a fall prevention program. So introduce yourselves and then start to tell us about what you guys are doing and how you guys are utilizing Stepping On.
Absolutely. My name is Daniel Sterling, and I'm a community health advocate with the City of Fishers.
My name is Chadon Hudson, and I'm also a community health advocate with the City of Fishers.
Yeah, well, thanks for being here. So tell me about your program, what you guys are doing for fall prevention.
Yeah, so as you mentioned, we do the Stepping On program, but that's just one part of it. So we also are part of a mobile integrated health team. And so we take that approach. It's a patient-centered model with our partnership with Fishers Fire Department, where we're able to respond to emergency service calls and follow up with them, and kind of take that approach at a patient level, individual level, where we can do home visits and kind of get the whole picture of their challenges that they face.
Yeah, that's awesome. And talk about preventing future ER visits, future injury, future hospitalizations, right? I mean, that is public health and prevention at the core is showing up at that time, so you can start making some interventions. So what else do you want to add?
Well, we would like to make sure that we keep people from falling. We all know that a fall can be very life-changing with an injury. And we're trying to prevent falls and do as many home visits as we possibly can for our target audience and anybody that's disabled that would need our services. We like to go and do a home safety assessment and just identify different things that might cause falls.
Yeah.
Rugs, they cause a lot of falls, so we have a lot of battles of trying to get folks to get rid of their rugs. But besides that, the home visits, hopefully, after we've made a visit, will prevent a fall and promote safety in the home.
Yeah, I agree. I do see a lot of people who trip over the corner of a rug. So it's something that, even though they look nice, at some point it's time to pull them up. I mean, I've even tripped over a rug before. So you have this really cool box of toys to help people to prevent falls. So why don't you show me some of the things that you guys are talking to people about and providing?
Absolutely. So a lot of falls that we see are from people bending too low or reaching too high to grab things. So this is one of our very popular things that we give away often, is just the grabber tool.
Another thing are pill sorters to help manage medications. Medications certainly contribute to falls, and by golly, when you go to a doctor and you get a new medication, it sometimes can have some consequences, and it's just good to be able to manage your pills and take them when you're supposed to take them.
Right, nighttime meds at nighttime, right? Things like that, exactly, yes. And then you have a non-slip mat, which is great for bathtubs and showers, and I say not just for older people, right? Little kids too can fall and slip, anybody, so something good, important to have. And you talked to me about this. What is this guy? So cool.
So that's the sock assist. So when an individual has trouble with moving their legs, they can use this to help get their socks on. They can use it to pull up their socks.
Awesome. So lots of other things in here to help people with.
The car assist handle.
Okay.
And then basically, you've probably seen this on TV. It's just an ad, but it's just a little assist to get in and out of your car. That's easily stored in the door handle. That's one thing. Night lights are huge. We have some night lights here. It's one of the things that we would like to make sure that people know when you get up in the middle of the night. Certainly, as we get older, certainly we make some bathroom trips in the middle of the night, and we want to make sure that it's lighted and safe and not cluttered from the bed to your bathroom.
Yeah.
And it just is a great prevention tool to make sure that you can see where you're going. Otherwise, bad things can happen.
Excellent. So there's lots of things that you can do to help prevent falls. So this is, if you have a family member or a friend who is older, reach out to them, reach out to these guys, have them come do a home assessment, see if any of these tools might help them. And then it is fall, and so as an ER doctor, I have to do my public service announcement. Leave getting on ladders to professionals when you are cleaning out your gutters with fleas, right? I mean, I can't tell you how many people I see fall off ladders, pretty bad head injuries, and of course broken bones. So it's fall, leave that to the professionals, and there's your extra public service announcement for the day. Thank you guys so much. Thank you for what you do. It is making a difference in your community. You are making a difference in reducing healthcare costs and then helping our older adults live longer and healthier lives. So thanks everybody. We'll see you next time.